a porcelain veneer, in contrast to a crown, is probably the best way, in my opinion, to explain that. A porcelain veneer literally covers the bulk of the surface that you see from looking at a patient straight on. So it goes in the margin where the tooth stops and the veneer begins, occurs in between the contacts, the side-to-side contacts on the teeth, goes over the incisal edge and down to the gum line. In contrast to a crown, the crown just goes around the circumference of the tooth, and the margin is usually hidden by the gum tissue. Where crowns and veneers tend to fail is they'll get recurrent decay around their margins of the interface between the tooth and the restoration, and there's more margins on a veneer than there is on a crown. So that's why I tend to lean to do more crowns than veneers, just with the idea that the veneers are more susceptible to decay and may need to be redone more often than a single crown.